So here we are at week 2. I mean, some of you are new to my group, so welcome. Remember, I do have a YouTube channel. You can always go there. You can always listen to any week. You can even go ahead if you want to, listen to future lectures. They're all there. You come to class prepared. Remember this week, last week we did have discussion questions that you had to get done, and most of you did them fine. Um, Remember with this week, you're going to have another quiz next week. That'll be on this week's material. Probably a little bit more confusing because now we're doing infants, toddlers, preschoolers. This is chapters 31, 32, and 33. And of course, there's another discussion question there. I will be putting information in to your discussion questions. So even if you get your 20 out of 20, go back and look at my comments. Sometimes those comments you're going to see as an exam question. So make sure that you do go back and look at them. And it actually gives you a little bit more insight into it and another perspective, or just saying, oh, I hear what you said. A lot of discussion questions. I learned a lot about you, why you want to be nurses. And I think, I was that person who I knew about age 4 or 5, I wanted to be a nurse, but I was always afraid of needles. And that was reason why I went into my PhD dissertation, all about school-age children attitudes and behaviors towards injections, because I was so afraid of needles. And actually, my fear became actually my strength. I could, start an IV on a rock or get blood out of something that nobody else can find. And it just became one of my strong assets that I overcame my fear. So you got fears, you can turn them into something really your strength, okay? So this week, as I said, we're going to go over those 3 chapters. We have a PowerPoint, and then we're going to do a Kahoots. Those who are joining me, you will be getting a recording. You'll be getting, again, the PowerPoint attached, and you'll also be getting the Kahoots that we're going to be due after. The Kahoots is like 60 questions. And the reason is growth and development. There's a lot of stuff. So what do you need to know? So you'll see concepts just over and over again. If you see questions, same concepts, different angles of asking the questions, you know that question is going to be somewhere, okay? So any questions about anything so far? I've already had 2 people ask me about a project for the week 8 pediatric assessment project. So one person picked it out as something different, never heard of it. So something I'm excited to hear about. Thank you very much. And then another person, something that they're interested that a lot of people around that have this disease or the trait, which was sickle cell. So it's really exciting that you're already thinking that far ahead. Again, I'm going to be telling you when you should be doing these 250-word papers, when to do this and that, because I know with your community, med surge is always a bear, but with community and peds, I know when those projects are due, trying to make it at that time where you can get, that little time that you need to do it, because I know you all are so busy. So first of all, let's go ahead, let's do our PowerPoint. It is attached to your announcement. I did attach it today. When I went back and looked at the PowerPoint and the announcement, I saw it wasn't there. I quick attached it. So it is there. You do have it for you to look over it. So let's talk about infants. I think they're amazing, right? They start out at 7 pounds and they can't even lift their head. They can barely suck, swallow, and breathe, right? And by 1 year old, they're walking, talking, they've tripled their birth weight. It's quite amazing how in 1 year an infant does that much. So it is the most dramatic. Absolutely. Your central nervous system goes from not even be able to control a grasp into walking, talking, and putting blocks and building towers of blocks, right? I think it's quite amazing. Now, how do we get there? Nutrition, nutrition, nutrition. If you don't put fuel in the tank, the baby's not going to grow. The mind is not going to be where it wants to be. So we need good nutrition, and we do need that trust that parents do give them, that they go and they pick them up and make them happy, happy babies. So they gain 5 to 7 ounces per week. They double their birth weight by 6 months, and they triple it by 1 year. You're going to see questions about the birth weight. And if it's less than, more than, what should you do? Again, more or less, there's going to be something that we need to do for them, some sort of intervention. They gain 1 inch every month for the first 6 months. Can you imagine how much nutrition and food they need to do that? So that's why these infants eat so much. And we know they get pudgy, get taller, pudgy, taller. And that's just what an infant and toddler and preschoolers do. So all of a sudden they're getting pudgier, and then all of a sudden you see them slim, they've gotten taller. And it's just part of what children do. So I did send you one of those vital sign sheets. It did show you vital signs start out, their heart rate and their respiratory rates are really high, right? 140 to 160 heart rate, 40 to 60 respiratory rate. And by 1 year, we're down to about 100 heart rate. We're about respiratory rate, maybe 30. So if they're breathing at 60, 40 a minute, there's respiratory distress going on. Or if their heart rate is 120, 140, are they with fever? Are they in pain? Or are they dehydrated? So knowing vital signs is going to help you figure out what's going on with these infants, okay, and these children. So at birth, we know mom gives them all their blood, gives them all their hemoglobin, their immune system, and all of those things, right? But babies don't start making any sort of their own blood cells till almost 5 months of age. So blood cells do die. So you're born with a good hemoglobin. Let's say it's 14 as an infant. And by 6 months, it could be 10 or 9. And that's absolutely normal. And then as long as they're not, showing any symptoms of distress, we'll leave them there, right? And then they start to make their own blood cells. Now, initially, mom gives all of their own iron to their babies, okay? And that iron, again, is in those red blood cells. The blood cells go away. So now we've got to make sure they get iron. That's why they're getting vitamin D in breast milk. That's why they're getting iron fortified formulas, because we want to keep that iron in them. Well, in OB, you learn that they're born and their heads are big, right? Bigger than their chest. Well, we know that their head is going to start to, it's still going to grow, but their chest is going to catch up. And that's somewhere around 1 year, 15 months. Okay. So we're going to see those changes. We're also known that their heads, they're born with those soft spots. The one up here, the anterior fontanelle, and that closes by 1.5 years. 1 year, 1.5 years. And then the posterior, the one in the back, we don't really think about that one because it closes very quickly. Now, why do we need to know those numbers? What if it doesn't close? Or what if it's open too long? There are issues with either of them, so we need to be aware of it and pay attention to it. When they're born, they don't see well, right? They don't see colors. They say black and white mobiles are fine, right? And then they get into colors and they like the colors. Each eye works separately. They don't work together, so there's no depth perception. But as about up to about 9 months is when we start to see them, they can grab and they can reach. And now we know the depth perception is getting better and better. And that's all about the being aware, being able to see. We know their hearing becomes more and more attuned as they get a little bit older. So babies are born, mommy's immune system. As they start to get older, why do we give all of these immunizations? Did you see the 2 pages of immunizations, in your book? It's like all of these things we give these infants, and why? Well, we're trying to build up that baby's immune system to prevent them from getting these diseases that are preventable from these immunizations. And it also, we know that the first year of life, they're going to be getting upper respiratories and ear infections and all of these things. And the baby's going to be making their own antibodies and their own protection. And as they get older and older, it's going to get stronger and stronger and stronger. We know about 9 months is when the baby starts making their own immunity, and we know that all of these things like the vernix and the I call it the white cheese at birth, right? Some of them get a lot of it at birth, some don't, but that's all protection their GI tract and from their skin, etc. Now at birth, babies are in this wet environment, nice and warm, mommy's uterus, right? They are born and now they're in their cold environment and they have no way of regulating their own temperature control. So at birth, infants immediately are dried off quickly and put underneath a warmer. And they're connected so that we can monitor that heat get to that baby because we know they can't hold their own monitor their own heat and keep themselves warm like we as adults can do. Because, we have all of our tissues fine, but those babies can't. We know that they have all of this extracellular fluid, right? This extracellular fluid makes them puffy. Ever see a baby born? They look all puffy at birth. Send them to the nursery. They do their little look at the baby and their assessment, send them back. They already look thinner because they've urinated several times and they've gotten rid of all that extracellular fluid. Now, one of the things infants do is their hands. Now, fine motor, gross motor, important. So fine motor is F, fingers, anything with the hands, okay? So first of all is how to grasp. Now, initially, mommy puts the hand into the warmer and next to the crib, and the baby just grasps it. It is an absolute reflex. It's not voluntary. It's just something that happens. So we start with a reflex grasp, and we call it palmar because it's not fingers, it's the whole hand. And then all of a sudden, they get this rattle a little bit later on, 4 or 5 months, and they're going to voluntarily grab a hold of it. And it's all palmar. About 7 months old, they can grab a rattle and transfer it to another hand. And then about 10 months is when they're sitting in the high chair and they can take, and initially you'll put like the little puff balls or little Cheetos, or not Cheetos, but little Cheerios, and they put them in their mouth. Initially, it's a smush, like it's a crude, what we call pincer grasp. By about 10 months, they can take their thumb and forefinger and very easily, one at a time, right? And you can watch that change as they get older and older. By 11 months, they can take things out of containers. And by 1 year, they should be at least be able to take 2 blocks, one on top of the other. Now, it doesn't mean some children do it earlier or later. As long as they're moving forward, it's good. Because remember, all kids are different. So that's a test for you to check later. Now, gross motor. I call it get up and go, 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 like Paw Patrol, right? What do I do? It's movement, it's muscles. First thing a child can do by about 4 months old is have head control. Now, you see the head control by those pictures to the right. Initially, you take them by their hands, pick them up, their head falls back. They don't have the muscle and the control to hold their head up. Look as you go down B and C, their head comes up. That is head control. That's what we discuss about that. Another thing is rolling over. By 5 months, they're on their bellies on tummy time. And all of a sudden you look and whoops, they've turned over on their backs. And by 6 months, they're on their backs and whoops, they turn over onto their tummy. Why is that important to know? Well, if you have them on a changing table, on a bed, on a couch, guess what? By 6 months, they're going to roll over on the floor. So again, it's telling parents about safety and you being safe with these infants. Now, it doesn't mean it takes up to 6 months for this to happen. Some are earlier. I mean, I remember my little Christian went to his first visit and he turned over on the pediatrician, and the pediatrician was like, wow. So you always got to be careful with them because all kids are different, right? 8 months, they should sit unsupported. Now, usually we have them sitting up about 6 months. We have pillows and propping them. What I'm saying, sitting is unsupported by themselves. And then about 10 months, they go from their backs and they can pull themselves up to sitting. Now, locomotion. This is that gross motor movement. So we know it starts with the head. We got good head control. Then all of a sudden we get up, we're on our knees, and we're starting to crawl. Now they go backwards first usually, and then they go forward, and that's normal. And then creeping is when you get on the side of a couch or a coffee table and you're standing, sort of moving around. And then about 11 months, you're holding their hands. They know how to put their feet on the ground and try to walk. And by 1 year, doesn't mean they're walking completely, but they're attempting to, or almost. Some kids are walking at 7, 8 months. Some kids, like all of my kids, all my grandkids, they never walked until about 15 months, but they did everything else. So again, it was still okay. Now you've heard me say it, I'll say it again. Nutrition, nutrition, nutrition. You don't feed the gas tank, the brain doesn't get fuel, it's not going to work, they're going to be cognitively delayed. Also, their height, their weight is not going to be where it should be. The one thing in pediatrics, unlike adults, every visit you go to an urgent care ER doctor's office with a child, they do a height and a weight. You ever wonder why? Well, mommy wants to know. So, yes, my baby gained a pound and a half or whatever, but no, if they're not gaining weight, not getting the height that they need, they're not getting nutrition. And we could do an early intervention and get them better nutrition. Sometimes it's increasing calories in either breast milk with a fortifier or in a formula, increasing the calories per ounce. So there's a lot of stuff we can do. Or if they're too much, find out what is this parent feeding them, because a bigger baby's not going to do all those gross motor things as quick because they're too big, right? Or maybe it's a pituitary problem. So again, there's, and we'll go onward. It could be thyroid, it could be pituitary, it could be adrenal, it could be so many things. So that's why height and weight, we're measuring it to measure nutrition and just so much more. And we'll learn more as we go through this semester. So at birth, infants lose about 10% of their body weight. You could have a baby born at 7 pounds and they're 6 pounds, 4 ounces when they go home. And that's absolutely normal. Now, we know that when the baby goes home, within 2 weeks, they probably are back to birth weight because they're eating, 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 eating. One of the things that breastfed babies, parents, mothers actually, mostly are worried about is is the baby getting enough? Especially if an infant was in the newborn ICU or something for several days and they're looking at bottles and measuring ounces and all of a sudden it's just breast and they can't do that. They're wondering, well, an infant has 6 to 8 wet diapers a day, gaining weight, they're getting enough nutrition, aren't they? As I said, that nutrition, we're always going to put, if it's that formula, it's always going to be iron fortified. As they get to be eating regular food, it's always iron fortified cereals because again, mommy's hemoglobin's going away, and what's in those red blood cells? It's iron. So we got to keep that stuff going, okay? And we know breastfed infants do get that vitamin D, and again, that does help. So at birth, why don't we feed an infant food? There's been so much things. I mean, when my infants were small, and let me tell you, my son is 40, my daughter is 39, and my pediatrician had me feeding them early. But why was that wrong? Their GI system is not mature enough. Now, when we give an infant food, the GI system is not mature enough, they don't get the nutrition, it's not absorbed, and it just comes out in the stool. So they're wasting time eating something and burning calories eating those things, and it gives them no nutrition at all. I mean, let's turn it around to us adults. There are foods we eat that we still don't break down enough. Think about corn. Corn is always going to be seen in your stool. It's the same thing with infants. You give them food too early, you're going to see it in the stool, whether it's green peas, green beans, carrots, corn, whatever, you're going to see it there. And we know, like elderly, the liver, the GI system, all of those, they're all immature. The opposite ends of the spectrum, And yes, they both have issues, whether you're older or you're the infant. So at 6 months is when we first decide, let's start giving food. We figure the GI system is good enough. Furthermore, we need to start weaning them off of just milk, breast milk, or formula. So we're going to start, first of all, we usually start out with rice cereal. And why rice cereal? It's the most allergenic type of food that we can start with. And we know that we start feeding them food and then we give them their milk, okay? One food at a time every 4 to 7 days. Why do we wait in between introducing foods? Well, infants can have allergies to foods. And we want to know what food did we give them that caused that allergy, okay? And we're going to be weaning them off the breast and off of all that formula. Now, we know that there are all sorts of food sensitivities and intolerances. Most of all, you're going to see things like abdominal pain, maybe a little vomiting, spit up, diarrhea, and then many a times it could be some sort of dermatitis type thing that you see. I've seen even diaper rashes with types of foods that we give. I mean, it can go to the point of anaphylaxis or just a little, gassy, more gas on this infant. It could be either or. So again, one at a time, every 4 to 7 days, and we can figure out what it is and avoid it. Or the physician might say, if it's not a big allergy, not anaphylaxis, of course, we can reintroduce it at another time. So, sleep. We know most infants, and we would hope, by 3 to 4 months are now sleeping all night long, letting mommy and daddy sleep, right? We know breastfed babies are usually fed every 3 to 4 hours. Formula babies actually tend to sleep longer. It's because breastfed it's not as thick, it's more watery, it's not as solid, and it goes away quicker. And that's what I say about it. They take naps. And, as much as we like the swings and all that sort of stuff, they really don't need it. Although I swear the swing was the only thing that could put my little boy to sleep when he was cranky and wouldn't sleep at all. So, it's a personal choice, but the book says it's really not necessary. Now, by 6 months, they say 6 months is when possibly the first tooth will come in. And what do you do with these teeth? Well, all we do is toothbrush, clean it before they go to bed at night, and then no milk, no juice after they go to bed. Okay. Fluoride can be started about 6 months. And the one thing that we have to remember with infants, not to prop that food because that sugar from milk or juice sits on the teeth and could rot them. And actually, believe it or not, my firstborn did have bottle mouth and those black teeth due to apple juice because many years ago they didn't have those sippy cups yet. And he would hold his bottle in his mouth with the nipple with the apple juice and it rotted his teeth. So these are things that have been learned through, 40 years ago. We've learned something from it, right? A pacifier. There has been, it's good, it's bad, it's good, it's bad. Well, what they finally come out and the research has proven, what does an infant do to soothe themselves? How do they do it? How do they explore the world? Through their mouth. You put a pacifier in, my husband calls it a soother. And it's the perfect word for it because they can self-soothe with their mouth or their thumb or their finger. That's how infants soothe themselves. It's how they explore their world, right? So, how many teeth? Well, they say how many months of age you are minus that 6 months where it starts, should they have at that time. Well, as I said, my kids never had teeth. They had 8 or 6 at 15 months. They didn't have any at that 1 year picture. They had still had gums in their mouth. But again, they were there ready to come out. And again, it was normal. But boy, did their mouth hurt when they all came out. So that big book, all of those immunizations, all of the which ones, when, and where. We know at birth it's a hepatitis B, usually given at the hospital. If not, it'll be given at that Usually it's a 2-week visit. They come in after they go home from the hospital. They might give it then. Why? Well, it could be insurance, many different variables, but as long as they get it, in that first little bit. Although, if you have a parent, a mother who has hepatitis, they have the first 12 hours to get that hepatitis B injection immunization, okay? And then we're going to go into which ones are important as we go on. We know 2, 4, 6 months. First time that we give influenza is 6 months, okay? And then we get up into the MMR and chickenpox as they get older, 15 months, 18 months, etc. Now, colic, I think, is one of the most difficult things to work with children. Little infants who have always gas pain, you've changed the formula 3 times, nothing's working. Usually, after a couple months, they grow out of it. Why do they have it? We don't really know. There's all care management, making sure that they're burp, sitting them up, holding them and rocking them, um, giving medications, Mylicon drops, gas drops, but this is something that, they usually just grow out of. Children sleep a lot, some don't sleep enough, and that's just normal. And then there's something called failure to thrive. What this is you feed the baby, you're giving them all the milk that they need, but they're not gaining weight for whatever reason. And we call this a failure to thrive. How would we know that? Well, they're 6 months old, born at 7 pounds, and they weigh 10 pounds. They should be 14 pounds, right? So there's a problem. Again, that's why we weigh our infants and children, all the way through, to make sure they're gaining weight. Failure to thrive is sometimes very difficult to diagnose. But again, we're going to have to do things like increasing calories and formula and giving them small, frequent feeds or whatever they need, changing formulas. Maybe it's a metabolic problem. Maybe it's an intolerance, an allergy to things. Anyway, failure to thrive is a difficult thing, but it can be handled. Now, sometimes we have today, and I think a lot of times because most infants today, what we tell them is they need to sleep on their back. When they're sleeping, it's back to sleep, we call it. And sometimes the back of the head gets flat and sometimes the hair disappears, right? And parents, especially moms, they don't like that. Especially on a little girl, we want a little bow, we don't want a flat head with no hair. So what would you do to a parent who's concerned about this positioned head, that it's flat in the back or sometimes on the side? Well, what we'll tell them is every day they should be having some tummy time. And actually their heads, their scalps, they're really soft and they're moldable so that when you get them off the back of their head, it will round out by themselves normally. Now, let's say it was a newborn intensive care or premature infant with a flat side of the head. Sometimes they need to do those helmets, that bottom right picture. And again, that's to help and keep the pressure off to round the head pretty. Now, diaper dermatitis. This is one thing that will keep an infant and a parent awake all night long. Probably the most thing that keeps them awake because you can, have them dry, change their diaper, put the creams or ointments or whatever, and they urinate or stool, and now they're awake at night and screaming. So, diaper dermatitis needs to be addressed. Well, why? It could be lotions, cream, shampoo. It could be those ointments that you use. I found out my children didn't like huggy diapers. They only liked Pampers. So it could be as simple as the diaper. So making sure we are going to be the foods as we introduce them to, as I said. So again, finding out the reason why and making all those steps in order to prevent it. Sometimes the treatment is just during the day, leaving them the diaper off and maybe a little bit of sunlight through the window coming through and having it dry out. Sometimes that's all they need to do is, to clear it up. And then the other thing is cradle cap, seborrheic dermatitis. They're born and they got this white crusty flake on their head. And, as I say, the little girls, I mean, I know my daughter, I love to put little bows in her hair and, I think it looks cute, but when that white flake there, you don't want to draw the attention there. So how do you treat it? Well, you're still going to use soap and you're going to shampoo their hair, but you're going to put some sort of oil in there. Some books say that you're going to put some oils, baby oil things, or it could be olive oil, just a nice, allergenic sort of thing, and leave it in overnight. And then a fine tooth, very gently, and it's going to, combing their hair take, a week or two, but it's, not going to be taken care of with one try, but eventually we'll take care of it and just keep it nice and moisturized. Now, SIDS death, first year of life. This is where we have determined that sleeping on their abdomens, even their sides, can cause SIDS death. Now, there are risk factors in it. Do you know boys are more apt for SIDS death than girls? If you're breastfeeding, you have less chance of SIDS death. Sleeping again on their tummies is not a good thing. And then cigarette smoke in the house. And if they're too hot, what if they just had an upper respiratory infection? Their nose is blocked. They're obligatory nose breathers. They can't breathe, SIDS death, right? Sometimes it's sleeping in the same bed as parents can cause it. The mattresses, that are too soft, too many things in the beds, no blankets, no toys, no bumper pads, none of that. Just a mattress and a firm mattress is all they need. And if it's cold, you're going to put just another t-shirt or something on that infant. Now, I've seen many little infants come in where the baby held their breath and turned blue, and the parents got nervous and scared. It could have been reflux, or it could be, an incident, we call an apparent life-threatening event. We call them an ALT. All right. It is what we call a missed SIDS event. So when this happens, these infants, and usually they're, again, under a year old, usually the smaller ones, and they're admitted to the hospital. And they do a neurological and a GI workup. And they're sent home with an apnea monitor. Now they're easy to use. It's a strap with little Velcro, has two little probes on it, and it measures respiration and pulse. Now you set the alarms, and if you hear this, you're going to wake up. And it wakes the child up and it startles them in order for, so that they're not breathing. So that's ALTI. Remember with children that they're rear facing, it should be in the middle of the car, actually, was what they say, okay? For infants, there's all sorts of hospitals that have all sorts of, car seat programs. They shouldn't get into forward facing until they're 2 years old or 30 pounds. And we'll go into that with toddlers a little bit. Safety, again, rolling over at 6 months, something, strapping them into they're on the changing table, not leaving them on a couch alone, a bed alone, because they will roll off. I can't tell you how many infants came in that fell off of beds onto, ceramic floors, tiled floors, and those sort of things. Again, more hospitals before babies are delivered or teaching parents CPR, very important. And then water safety. I live in South Florida. Water safety is very important. I've seen drownings, and they are devastating because it's a lifelong problem because of that hypoxic episode. So, Letitia is a breastfed infant being seen in the clinic for her 6 month checkup. A mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best nursing intervention? Can she suck her thumb? Is that okay? How does the baby self-soothe? In the mouth. Do you have to have a pacifier to self-soothe? Not at all. It is absolutely normal. My daughter liked this finger this way. Some like the thumb, some like the other fingers, pacifier, everything. What it is at 6 months old, this infant is trying to soothe herself, and she explores the world in her mouth. Okay, we're going to go into some theorists. Now, theorists are confusing, and it's something that I'm going to try to explain in a manner that you can figure it out because some of these words you're going to say, I don't understand. Now, I did sort of mention last week about Erickson. This is, Erickson is all, oops, sorry about that. So when we talk about Erickson, it's all about psychosocial. What does that mean? It's about how an infant perceives the world around them, about the people around them, and how do they affect the way that they are. So an infant, what's all they need? An infant cries, somebody comes and gets them. They're hungry, or they're wet, dirty, or they just want some attention, right? So an, an adult goes in, picks them up and grabs them, takes care of their needs, and they're a happy, satisfied baby, right? Now, sometimes there could be some sort of environments, could be drugs, could be abuse, could be, just their social environment, homeless, etc. Infants cry, 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 nobody picks them up. Well, this infant learns mistrust, which means after a while they didn't even cry because nobody's going to come get them. Okay? So, Piaget. Now, Piaget's all about thinking. Now, think about an infant. They're born. They don't even know how to suck and swallow and breathe, do they? Learning how to suck and eat is the first thing that they learn. So the second thing infants use is now they're exploring the world, right? We have hands, we have feet. What do we do with them? Initially, it's that reflex palmar grasp, right? Then what happens? Mommy's playing with them, has a little rattle, shakes it, and they grasp it voluntarily. So now they have learned how to grasp a rattle. Well, all of a sudden they move their hand and the rattle makes a noise. And like, oh, I like that. So now they've learned, get the rattle. If I shake it, I make a noise, and that's fun. And then it goes in their mouth. And like, ooh, I like that. Because remember, exploring the world in their mouth. Okay. So we've just learned all of these cognitive things there, right? It could be they put their hand by their mouth, their finger, their thumb goes in there, and they're learning. This is how they learn. It just happens. It's not that they were taught. Maybe the mother did it for them, but now they've had to learn how did it get there? Okay. As they get older, it's that imitation. Ever take a little infant, with their trying to, they're going to be sucking their thumb, and they are, um, you know, you have infants where they're looking at you and you stick your tongue out, and all of a sudden they're trying to stick it out at you. And little infants at 3, 4 months will do that. Again, that's imitation. And we know play, tummy time during the day and looking for things. And, they're learning, ooh, there is something. So again, you start with something easy. First, you got the rattle in your hand, then it's in the mouth and you're shaking it, right? Now we've learned quite a bit. So Piaget has these big words, right? Sensorimotor. Let's break the word down. Sense is what it touch. Ori is all in the mouth. Motor is movement. This is all the way play, the way that young infants, toddlers learn. Then it goes up into pre-operational. And this is like babysitting at the high chair, having dinner, and accidentally knocks the sippy cup over on the floor. Guess what? Mommy comes over and picks the cup up and puts it back. That infant just learned, that toddler learned, I knocked that off again. Mommy's going to come. So I'm going to get mommy back here where I want her to be. So again, see how they're learning here? Okay. Then as we get older in that pre-operational, it is taking a broom and it's riding it like horses, putting your arms out, playing like an airplane. They sort of learn these things as they get older. School age, will go into it more, but it's something concrete. They've seen it, felt it, touched it, and they can do it again. That's learning, right? Because they saw it, touched it, and they could figure it out. And then formal operations, adults, they figure things out. Nobody had to teach them anything. I always say adolescents, they want something, they can fight their way out of a paper bag and make it work because they know how to figure it out what mommy or daddy wants to get what they want. And we'll go into that more as we get older. So they start getting this body image. Ever see an infant sit there in front of a mirror and touch it, try to suck on the mirror? Again, we're starting to learn about it. And we know it's all about movement, things around. It's all, again, explore the world in the mouth. Remember, this is that thing that soothes and explores the world at first. As much as we don't want them everything in the mouth, it's going to go in the mouth. Something called object permanence is acquired. So you have that rattle, even a young infant, and they're on tummy time, and they see you put the rattle, but it's now hidden somewhere. Well, even though it's not visible, they know it's still there. Think about the toddler. You take your toys at night, you put them in the toy chest. Toddler wakes up in the morning, goes to the toy chest, and he knows his truck, his doll, whatever, it's still there, right? Object permanence, okay? And of course, children as they get older know mom and dad and know the differences between people. Now, one of the things I think is difficult for parents is the separation anxiety. So most of us, if we're lucky, might get a couple months with our infant at home for maternity leave, right? And then they got to go to daycare. And the first day you take your child, bring it to daycare and give it to the person, guess what? They scream and yell and cry and go bonkers because mommy's not there. Well, separation anxiety as they get older becomes even more than that. There's 3 stages of separation anxiety. We start with the screaming and yelling and crying, and then we go, well, I guess they're not coming. And then they start sucking their thumb when they're older and they haven't done that. Or they become, they're potty trained and now, ooh, they wet their bed. And then it comes to the point where mom and dad come back and they ignore them. So separation anxiety, there's 3 stages. Stranger fear. Go to take a little infant, 6 months, and you need to hand your infant over, let's say to the nurse or someone. No, no, no. They're going to turn around, put my hands out. No, I want you. I don't want them. But as they get a little older, they're going to be peeking around the corner saying, ooh, who is this person, right? And we know we start, their first language is crying. Then it becomes that little cooing. And then by 1 year, we should be saying a couple words. Mommy, daddy, Nana. I had my grandson saying Nana. So I thought that was pretty good. And always social, play, play, play. Play is that sensory motor thing that they need to do. And children of all ages are still playing. So toddlers. Now toddlers are ages 1 to 3. I love these type of kids, and I love this Seinfeld quote. Having a 2-year-old's like having a blender with a lid off and turn it on. They're everywhere all at once, aren't they? You can't keep control of them. You blink an eye and they're in a cabinet. They're into this, underneath there, around there. It's amazing how they're exploring the world like crazy. So we think of toddlers. They're all about me, me. I want, no, 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 me, 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 me. They are all over exploring the world. And then, of course, there are in temper tantrums when they don't get what they want. Normal, normal, normal. Now, first year of life, they've tripled their birth weight. It never happens again. Okay. Not to that extent. It slows down. They should be quadrupled their birth weight by about 2.5 years. Well, we tripled by 1 year. So it took another year and a half to get one more there. So they do slow down. They get about 3 inches a year. They get taller, and they get pudgier, and they get taller, and it's stair step, just like that. Again, the head by 1 year and a little bit should be equal to or less than the chest. The chest is getting bigger. And by 2, the child should be half of their adult height. So you can look at your 2-year-old and say, they're 2 feet, 3 feet this. Well, they're going to be this when they're adults. So we're born, you cannot control their urine, their bladder, their nothing, right? Well, they're starting to get more control of everything and more mature. They're getting longer, and as they get older and toddlers, they're getting more agile, not as clumsy, right? They're going through respiratory infections, ear infections, throat tonsillitis. Yes. I mean, think about toddlers. Think about what they do all day. If they're in daycare around other children, I call daycares where we take our children, they go there, and what do they do all day? They play, right? In play, they take toys and they explore them all in their mouth. They swap spit with all the kids all day long, and it's normal. And they need to. Why? It's because they need to build up their immune system, right? So, but you think about it, it's like, I mean, as well and as good as a daycare can be, it happens and it's going to happen, okay? Their body temperature, much better. You don't have to bundle them up as much. It's not like that newborn that you have to make sure that we control their temperature. We get to the point where they control their bowels and their urine. Remember, bowel training is before bladder training, okay? And we know our skin is all there as a defense system. We're getting more and more coordinated. We can use both hands. And by about a year and a half, be careful. They're going to throw a ball overhand. And if it hits you, it's going to hurt. My grandson, the first time he did it, sitting on a couch, he threw it, dismissed my head, and it bounced to the other side of the room. It was really hard. So it's what they do, and it's normal. Their sight is getting a lot better. Remember, each eye didn't work the same. Well, now they're working together. So now their depth perception is becoming a lot better. Okay. At birth, you can feed an infant anything and they like it. Have you ever tasted formula before? Ugh. Have you ever tasted some of the baby foods and cereal? Ugh. Well, infants love it and they gobble it up. Well, toddlers' sense of taste and smell and even the textures becomes really refined, and they don't eat, become finicky, picky eaters. I call these, they go into a physiologic anorexia. They barely eat, but they're not gaining much weight, are they? They need 1 tablespoon of food per year of age. It's all they need per feeding. So it's not a lot. Now, it's a lot less than they did when they were infant, but just think about infants gaining weight and growing quicker than do toddlers, okay? Now, Erickson. Erickson again, psychosocials, all about the people around them. Well, they're all about me, mine, autonomy, automatically me, mine. That's how I think about autonomy. Now, I want to go explore, let me do. That's what they want. But what's the shame and doubt? Parents tend to, and even me as a grandma, tend to try to do things for these kids, and we need to let them try themselves. Whether it's getting dressed, even if it's backwards, inside out, done wrong, but it's the attempt is what we're looking for. It is them jumping from the couch to the other couch and letting them attempt to do it, even though they might fall, as long as they're not going to hurt themselves. Okay. The shame and doubt is me and, another adult saying, no, be careful, don't do that. I'm not telling you they shouldn't try. The shame and doubt isn't that they did it wrong, it's that you're not letting them try. You need to allow these children, these toddlers, try to do these things. Again, that negativism is no, 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 no. That's all they know at this age. And the one thing that really keeps a toddler calm and happy is what we call ritualism. Put them on a schedule. And this is hard when I'm talking about in a hospital. Try to have them same foods, if we can, whatever the diet allows, right? Bedtime, nap time, bath time. Try to keep it on the same schedule. I think taking a toddler on vacation is the hardest thing to do because they want to sleep at this time, nap at this time, these foods, and you can't always do that. It's the same thing if they're in a hospital too. And then, if we talk about id, ego, super ego, they're all id. It's all about me, me, I want to do. Okay, that's all what that means. Now Piaget have gone into, some of these things. Remember, Piaget is all about thinking, figuring things out. First thing we did is we figured out how to suck, swallow, and breathe. Then we took the rattle. Then we were able to grab it. We did that. We shaked it, made a noise, put it in the mouth, and we chewed on it. Okay. Then we get into um, things like putting the arms out, making an airplane, taking a sippy cup, throwing it on the floor. It's learning, learning. Remember, start with very simple and then get to, more complicated. Okay. So Erickson, it's all about no, 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 me, being on a schedule, and they're the sense of, the world. And again, the shame and the doubt is when somebody doesn't let them try, or you always tie their shoes. You always you always stress them. You need to let them try to do these things. And it takes time. And I know that we're busy people, but we got to give them the chance. And then Piaget is learning things and building upon them. So if that sippy cup going on the floor worked, well, maybe if I threw this on the floor too, or maybe if I did this, I'm going to get what I want. And that's a little bit more of it. Again, showing more pictures of it. Now, they are starting to understand the difference in male and female. And a lot of times it's because of potty training, right? They see mommy sitting on the toilet, but daddy stands up. There's a difference. And then this is a time where you have a penis and you have a vagina. Or, I mean, they say you should use the names, not other little nicknames that some people use. And that, it's a parent's choice. I mean, with my little Christian, he knows a penis and a vagina, and they're just those names that he does know. We know that they're going to play house and they know mommy and they know daddy and they know those things. Then they aren't going to be touching themselves. They're exploring it down there. And if their hands are in their pants, I always say, you don't want to put your hands in your pants. Do you itch? You have to go to the bathroom. Okay, well, go to your room. You can do that by yourself. We don't need to watch you do that. Not making them feel bad, but putting them where it's appropriate. We know that children know the difference between mom and dad and the things that they do. And then we get to the point of language. So at 1 year, they could say, one word sentences milk, mommy, daddy, whatever, right? By 2, I want to play. I want Nana. I want dogs. Whatever it is, they're going to learn multiple word sentences. The thing is, they understand more that they can say. And the problem with is it's hard for them to express. So sometimes it's a parent saying, I don't understand what you're trying to tell me. Can you show me? And that helps them, again, building up their language. Okay. They need to become more independent. Go get your shoes, right? A 2-year-old should go be able to find their shoes, go bring them here, or here, go put this in the laundry basket. Little things you can start teaching these children. So give them some independence, something that they can do, right? Or tissue, go put it in the garbage. 2, 3-year-old absolutely should do that. So we need to let them start feeding themselves. If the spoon is backwards, upside down, the wrong way, it doesn't matter. It's the attempt. It's not that it was done perfectly. Okay. It's the attempt. It's that dressing, whether the shirt's on inside out or, the shorts are backwards. It doesn't matter. It's the attempt of trying. Okay. So one of the other things that toddlers start having is when they see mommy not feeling well, they're going to kiss it and make it better. Give you a hug. I've seen those things on those children. They're starting to understand others at this point. Now play. Remember, toddlers, me, mine. I'm not going to share. Parallel play. One toddler, the other toddler, and don't touch my toys. They can play next to each other, but don't touch mine. You have yours, this one has theirs, and they don't play with each other, okay? Now, they do imitate and they like all different textures, whether it's sand, whether it's blocks, whether it's whatever. They all of these things are part of that sensory motor. It's exploring the world again. So toilet training, they have to understand and feel that they're ready. When ladder training starts is when they have a diaper dry for 2 hours. And usually, again, as I said, bowel training comes first. They feel that more. Sibling rivalry is always there. You're paying attention to your little baby sister more than me, you'll see it. And sometimes you'll see it temper tantrums where you just cannot, calm them down. A lot of times it's bedtime. Why is that? They might miss something. If put them to bed now, I might miss something, right? So bedtime can be difficult. Again, no, me, mine. And toddlers, when they're stressed, when they're upset, they have a child who hasn't sucked their thumb and, something happens, you'll see them sucking their thumb or they're potty trained and all of a sudden, they're incontinent. This is the regression. It's part of showing you they're stressed. As I said, nutrition, right? They're not eating, and now we're getting nervous. As I said, 1 tablespoon food per year of age is all that they do need. Remember that sometimes you have children on special diets. They're only on, they're vegetarians. That's what the culture is. Remember, they might need some sort of supplements. They might need, the milk can give them some calcium. And remember, they're not eating protein. Let's say they had surgery or have a big, wound. They don't have protein. They're not going to heal good. Again, protein is about wound healing at any age, okay? We know that some parents do these complementary sort of medicines. It's okay. As long as when you're doing these complementary alternative type medicines, for instance, let's say you have a child who does have a seizure disorder, and your decision is to try some CBD oil or one of those things, which is not really medical community, right? As long as the physician knows what's going on, and it doesn't hurt the child, is that wrong? It's the parent's choice. As long as it's part of the whole type of way we take care of those children. And we know some kids sleep a lot, and some don't kids don't sleep as much. And again, it's trying to figure it out and making sure that they get enough rest. So toddlers, we know that they're getting all their teeth in. They do need to go to the dentist and they should be flossing. Um, the thing with flossing, though, is when they're younger, it's going to be the parents doing it. Usually they can't do it till after they're 6 years old because they don't have the ambidextrous to do it. They just can't do it. So, again, making sure their teeth are good and clean. Again, as I said, dental caries are a big thing. My son did have them. As I said, children explore the world through their mouths. Um, these children, lead poisoning is one of those things. Think about kids standing up now, their ages 1 to 3, staring out the window of an older building with a windowsill, right? Biting on it in the paint. That could be a lead poisoning, right? And lead poisoning is something that's going to need treatment through either medication or some sort of chelation therapy. Could be that machine there, an apheresis, pull the lead off of them because it can be dangerous and it could cause death in a child. So again, being aware of these sort of things. The most frequently ingested poisons, I'll tell you the one that I've seen all the time is our Flintstone vitamins. They just like to get a hold of them and chew them because they're so good. Now, That actually will get rid of the vitamins. But what if it's their acetaminophen? Now you're talking about liver failure, right? Or ibuprofens. So what do we need to advise our parents? They need to have poison control number on their phones ready to dial whenever they ingest any sort of thing, right? We do not induce vomiting. They used to give Epicac years ago, make them vomit. No more. Yes, Yara?
You want to hear a story that I was just thinking of that goes with this? My daughter is 7 and she has this little digital camera that she like plays with in her room, like one of those leapfrog things.
Uh-huh.
And she opened it up and then took the battery out of it and licked the little prong. And then she ran in my room and she's like, I licked some caramel and now my tongue's burning. I'm like, I don't buy no caramel. So then freaking I run in there and I'm like, why did you lick a camera? And she's like, it was an accident. I'm like, yeah, you accidentally did this thing or whatever. But I had to call poison control.
Batteries are dangerous
Yeah,
because they go
she
in the
was fine.
stomach. They go in the stomach, the I've seen those little round batteries that they ingest, and they do go in, and then the stomach acid gets it and breaks it up, and it could eat away the stomach lining. So again, perfect. You call poison control, see what they need to do. Maybe it's they need some milk to whatever. But anyway, always having, especially toddlers, how do they explore the world? In their mouths. So having that number there is important. Again, we're talking about car seats. I said at age 2, we could do front facing at 30 pounds. Now, Christian was 26 pounds at age 2. He was a peanut. He's been 50 pounds for the last year and a half. Now, he's smart as a whip. He's gifted, but he just doesn't gain weight. So we asked the pediatrician. Now, it's the muscle control that they were concerned about, not necessarily the weight. Okay. So car motor vehicle safety important, and they should be in booster seats up till 8 years old. And they say back seat till they're 13. My kids when they were younger, they used to always call shotgun for the front seat, right? When they were 9 and 10 years old. They should have never have done it. They should have been in the back seat for a long time. Again, safety with the water, very important in teaching. Got a pool in my backyard. My grandson knows he can't go in without asking, and that child could swim without any floaties at age 2. He was doing front flips and back flips at age 2 in my pool, and he's been swimming for a long time, but will not go in that pool without asking first. So again, being safe, making sure there's no plastic bags on the floor and medicines and et cetera, et cetera, et cetera. Remember, car seats do expire. They shouldn't be old. And any questions with it, you should ask the pediatricians. Pediatric hospitals always have some sort of car seat on a Saturday. There's these big seminar things. It should be shoulder straps, should be fitting snugly, should be in the center of the back seat. And the infants, we could take and roll blankets and get them snug in there, making sure that they're snug and safe. So gross motor skills are some more for you to look at. So now preschooler, ages 3 to 6. So 3 to 6, 3 to 5, these children now are preschool. Now they're getting ready to go to school, aren't they? So it's really important as parents to teach that we should have this positive attitude. We should be reading to these children every single day. We need to have them understand and be around children, how to share. And then, of course, that attention span, right? Some children who never had daycare, etc. They need to know how to share with children, how to get along with it, and of course, they're going to be away from mom, and they're going to be starting to learn things. Again, they're still slow, their growth, 5 pounds a year. Again, their body system are getting more and more mature. We know that they're running and jumping more than better than they have been. And preschoolers, unlike toddlers, handle stress a lot better. Toddlers don't like any sort of change. They like that consistency, but preschoolers do better with it. So gross motor, they're walking, running, climbing, jumping. And fine motor, now we can take and we have good eye muscle control. We can buttons on a shirt. We can draw circles. We can dress by ourselves. All of these things are getting more and more. Okay, Erickson, psychosocial, the world around them, right? Now, part of this is understanding how to do things, right? Now, one of the things is understanding that there's other people, caring other people. And part of it, it's like a Kohlberg, but it's wrong and right. It's part of understanding what did they do right or if they do wrong here. They're getting ready to school. Again, we should be reading. We should be that positive attitude towards school, getting them ready, getting them excited to go there. So cognitive, Piaget, thinking. So now they can speak better. Their language is getting a lot better. They can express themselves better. They're understanding they do something wrong. There's something that's going to happen that they're not going to really like. Probably something being taken away, right? They don't understand time, but they understand after lunch, your mommy's going to come pick you up. In the morning, when the sun comes up, we're going in the car and going to Disney. They understand that. They don't understand the clock. They don't understand that all. I know that when Christian used to come see me, I used to tell him, you're going to stay with me for 2 morning times. That means the sun comes up twice, 2 days, he's staying with me. He understood that. He didn't understand what 2 days was, but he understood every day in the morning the sun come up. That he did understand. That's that concept of time. And then magical thinking. Ever sit next to a kid who's in this age group and they're playing with cars or dolls or toys? They're talking and it's going up in the air and they're hitting each other and hugging each other and they're running and walking and all this magical stuff going on is part of that play and it's a good thing. Now, Kohlberg, reward and punishment. They know what's right and they know what's wrong more than would be a toddler. Toddlers don't understand this yet. So toddlers are really, I mean, at the end they go, no, you can't do that, but they don't get it. They don't understand why. But right now they do understand reward and punishment, good behavior, bad behavior, and that there is a consequence. They're starting to understand differences. Blonde hair, brown hair, freckles, blue eyes. They're understanding dark skin, light skin. They're starting to understand all of these things. Another thing is this is the age of band-aids. They think that if they get a cut and there's blood, they're going to bleed out and they're going to die. But you put a band-aid on it, all better, nothing's going to happen. It's going to leak out. Okay, that's what they feel. And it's true. I probably have 1,000 band-aids in my house. This kid, it's bleeding, oh, get a band-aid, put it on there, so they're there because that's what they understand. Spiritual, again, they only know what the families taught them. Is Christmas Santa Claus? Or is it Santa Claus and going to the church? And is it Jesus? Or is it something else, another culture? All they know is what they have been taught, okay? And they also know if they've done bad, God, or whatever the name of that higher power is going to punish them. Remember, they understand right and they understand wrong. They think that if they broke their arm, it's because they did something wrong and they got punished from that, whoever that higher power is. Baby girls love their daddies and baby boys love their mommies. And that's just part of, the sexuality as they grow up. They're going to start asking questions about where the babies come from, right? They're going to start understanding that there are differences as mommies and daddies. But a lot of questions are going to start here. They know that, let's say you're in a hospital and you're with a child who is a preschooler. And if they have their special blankie with them, nothing's going to happen to them, or their special toy. It gives them that comfort. So it's something that in a hospital, you need to know if they're still with a pacifier, which is the one that they like, which is the one that really will help them calm down, right? These are things that we as nurses need to know. That's the security where it comes from. Play therapy. We have child life in pediatric hospitals today. It started about 15 years ago, as I remember. They first started, and I was like, who are these people? What do they do? Well, these are extremely well educated people with a minimum of a bachelor degree up to a doctorate degree in play. And what they do is they study developmental levels and they know how to approach a child of any age and to teach them what's going to happen. Now, play therapy is that child who's afraid of something and we don't know what it is. So we have them play, and that child life person can help them work with why are they upset? Why are they afraid? And find out what it is. So, as healthcare professionals, we can take care of this child without them going crazy and be so afraid of us. Their language is amazing, and they use words that don't really fit, but those words are really long and they're very impressive, right? Transportation, teleportation was a word that Christian used to use all the time. And at the time, I don't think he really understood what it meant, but it was a word that was always thrown in there with something. Again, it's getting more and more sophisticated. They're able to express themselves a lot better. Their social behavior, again, they don't need those rituals and that no, 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 like a toddler. They're getting a lot more able to deal with changes, um, easier on vacation to bring these kids. They're in a hospital because they're not as, I need this at this time all the time. They can dress themselves. And toddlers love to please. They want to please you. They want those praises of that good stuff. And remember, they only know the standards and cultures of the family. They don't understand differences in religions and peoples or cultures. They don't get that yet. That comes later on as they start getting friends and other different families, right? Play. Now, we've talked about play already. We started last week with it. These children now, toddlers are parallel play. They don't share. Next to each other, no share. Associative, they're sharing the toys, but there's no goal. They don't build a house. They don't build a sandcastle. They don't play checkers and win a game. No, this is playing together and just having fun. Two or more children. They do imitate other children, and of course, imaginative. They have a truck and it's flying, and it's, a doll and it's Superman and Spider-Man, and spider webs are shooting all over. I mean, this is your typical preschooler. Dramatic play can show a child what's going on. It could show a procedure that might be going on, showing them that here's an x-ray and what you're going to see, and a picture and a camera and all these things. And of course, mutuals playing together. Now, preschoolers have fears. They hate the dark. They won't go in a room with the light off because there's going to be a ghost in there and somebody's going to hurt them, right? They're afraid. It's just part of them. They don't want to be alone. I mean, ever leave a child in the house and walk outside for whatever reason, come back in, the kid's sitting there crying because they couldn't find you. They don't want to be left alone. They don't like large dogs. They feel that they're going to hurt them. And they're afraid that something's going to happen to their private parts, castration. And look at this one. Objects or people associated with pain. Guess who that is? Nurse. Because what have they done every time they go to a doctor's office? they get an injection, immunization, right? Something's going to happen, a throat swab, something. So again, they're afraid of the medical people. Now they're starting to ask more questions about sexuality and pregnancy and all of those sort of things. Again, we're not going to sit there in pregnancy and tell them what mommy and daddy do to have a baby. No, mommy and daddy hug, and then they want a baby, and mommy gets pregnant. Okay. As I said, using correct anatomic words are actually best. And always, preschoolers, they don't forget. So be honest. If something's going to hurt, let them know it's going to hurt. But I tell you, I'm going to do everything to make it as little as possible. And you're honest, that's all what a kid really wants. They're less afraid if you say that than let it hurt and you never told them, because now they're never going to trust you. They also now have found their body parts and they are masturbating. Again, they do it at weird places in front of, your friends and them. So say, could you please just go in your room? If you itch there, just go in your room. That's not here. Don't do
All I
that.
can do is pray for him, Miss Bogart. That's all I can do. I can't condone such a behavior in my home, ma'am.
I'd say go to the other room, or you have to go to bathroom, or get your hands out of there. I mean, you don't want them to feel that touching themselves is wrong, but you don't make it that it's okay too. Because no, by yourself, there's things, but no, this is not proper. Again, it's a private act, and it's fears we've gone into. So we know children, some of the problems that can happen is speech. We know that's between 2 and 4. Earlier than that, we can't really evaluate it. We can get into speech therapy. The beautiful thing about children, we get them into some sort of therapy, they catch up really, really quickly. So if they're having a problem with stammering and stuttering and can't speak well, getting them into speech therapy, we call it early intervention. The earliest we can get them in there, the better they'll do, and they catch up very quickly. Preschoolers tend to have problems at night. My second grandson had night terrors. Middle of the night, he starts screaming and yelling, and he didn't know he was. It was like a half awake, asleep thing. So these are things that need to be addressed. Sometimes it needs medication, sometimes not. They don't want to go to sleep. Again, they might miss something very similar to toddlers. But again, some sort of consistent bedtime routine, having them quiet time before they go to bed or reading the book, those things need to be done, and for them to know it is time. It's that slowing it down, getting them ready to go to bed. Injury prevention, always. These kids now are riding bikes, getting skates, and all of that, making sure they have the proper equipment, making sure that they know about cars. One of the things about preschoolers, you have an increase in pedestrian motor vehicle accidents. I can't tell you, I've seen 3 or 4 preschoolers ran over by parents, by the next door neighbor, where they went behind a car because they didn't know better and they were in their own yards. Or let's say they ran out of a parent's hand into a parking lot. So this is injury prevention, showing them, teaching them so that we can prevent them and these things happening. So again, families need to understand they need to protect their children, explain it, sitting down with them, and now they're going to be entering school. Communicable diseases, again, you put them in classrooms, other kids, we're going to have, those children spreading, diseases in between each other. And that's absolutely normal what they're going to do. So nursing care, when you have a child who comes in upper respiratory, understanding, doing the assessment, are they in any distress, respiratory distress, etc. Their immunization history, so important. An upper respiratory could be a viral, or it could be something, pertussis. So again, knowing your child and their history can help you take care of them and protect other kids too. Again, promoting Immunizations, if we do have some parents who don't want immunizations, remember if you have a child like that, first thing I do is I put on a mask. I need to protect me, and that child needs to be put somewhere so other kids that are immunosuppressed, are not going to be getting disease from them. And then always hand washing. Hand washing is always your number one infection control. Kids get a lot of eye conjunctivitis, right? So how do we take care of it? It's that ooey gooey green yellow secretions, usually worse in the morning. A warm, moist washcloth from the inside out, one washcloth to the one side to the other, and make sure we put the medications. Remember, if we're using an ointment, making sure we tell them their vision's going to be a little blurry. But once that medicine melts, they're not going to be blurry because it's scary when you don't tell them, even with adults there, right? And this is something I would tell my parents, not in a book. Tell them to change their pillowcases before they go to bed every night with conjunctivitis. If they go back to sleep on the same pillowcase, they're recontaminating themselves, aren't they? So I always tell them, change your pillowcases, right? Stomatitis, those cold sores, etc. Again, pain relief, just simple acetaminophen is something. And again, hand washing, hand washing. We can have pinworms. We can making sure the pinworms are something that kids with long nails, who they like to go out and they play and it gets in, their bodies, making sure that we check the whole family and that they get their medications, in order to take care of that. Child neglect is real. I've seen several cases in my career, and it is physical, emotional, or emotional abuse. It's neglect abuse. So it could be food, shelter, clothing, medical care, education. I've seen one child that for a month was strapped to a bed and was not given any food. Came in and had absolutely no body fat on him and barely made it to the hospital before he coded and almost died. And we saved that child, okay? I've seen children emotionally that, they were so, you could see their affects, that they didn't look to mom and dad for attention at all because they weren't given any at all. And we know that children that have no self esteem because parents haven't done it. Physical abuse happens, where they are hit, whether it's, with belts or with burning or cigarettes or many things. Um, we know mush housing syndrome is something that I've seen only twice. And it's when a parent keeps the child sick for the attention. It could be as in giving them, let's say they're in a hospital, has IV, they might put like stool or dirt in the IV or with a wound, keeping it dirty or feeding them foods or chemicals. How do we as nurses, if we suspect wish housing, how would we take care of that? Well, this is that parent that can't be in that room alone with that child. Okay. And if they bring foods and whatnot in, these are things that must be inspected and watched over really closely. Our job as nurses is to protect our children. Okay. And it's better to be safe to protect the child than it is to ignore it. Okay. I'll go into more as we go on, more cases in other areas. So, with maltreated children, you suspect it as nurses. We report it to our charge nurse, to the physician. Many times, DCF will come in, and they'll evaluate it. So, again, our job is to make sure that kid, that abuse stops. Okay. So, watch out for our child. So the parents tell the nurse their 3-year-old daughter and a male cousin of the same age has been inspecting each other closely as they use the bathroom. Which of the following is the most appropriate response by the nurse? And these things happen. Now, I know you want to go in there and scream and yell and go bonkers. I understand that. But literally, what is said in your book, you can either condone or condemn it. Just say, come on, let's go. Wash your hands. Let's go. Let's have something to eat. And stop it there so that they know that you were there. You knew what was going on. Come on. And then you're not going to let them go to the bathroom together after that, are you? So let's do a cahoots. Now, we have 60 cahoots. I can go through it all, or we can do partial of it. So whatever you all want to do.
You can all get smoked on this Kahoot. Justin, I know you won last time. Not today, sir. Sorry. Everyone's an enemy. Preying on all your downfall. Betty Bogart, you know what to do, baby. Let's go.
Here we are. Now, again, some of you, if you do have a class, you need to leave. I understand. Um, this is just a lot of information on growth and development. All right, let's get going. We can get most of this stuff done. Week 2, infant, toddlers, preschooler. Lot of stuff, lot of concepts. So I'm multi-select. Types of play considered to be sense pleasure play. Sense. What is a sense? Sensory or motor? So when we're talking sense, it's anything you touch and feel and play with. Sand, fingers, and even those mashed potatoes in the high chair. My kids used to love to smush up their food. The nurse notices white patches in the mouth of an infant that cannot be removed with a tongue blade. What's the intervention for that? What do you think it is? Again, not everything is going to be in a PowerPoint, but hopefully I can get to you, this stuff in the cahoots. And this is what we call ungo. This is what we call thrush. And we do have to give medicine. This is nystatin. Now, on an infant, how would we give it? We would take a swab, put it in the medicine, and swab it on the white patches, okay? Older kids, swish and swallow, yes. But on an infant, you have to swab it for them. What type of play is cooperative play? It says 2 or more children playing together with a goal. Goal checkers. That one is your cooperative. There's always a goal with cooperative. That's your older children. It's your school age, actually. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning. Kohlberg, preschoolers, what do they know? You talk morality. What do you think about? Well, you think about right and wrong and a consequence. Okay. That's what they understand. Toddlers, infants, no, they don't know that yet. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? So, ages 3 to 6, going in for a procedure. What are you going to do? I mean, if you tell a kid what's happening, they're going to be not upset. They're not going to be stressed. They're not going to be afraid, right? Use a doll. Explain it to them. Use a doll, or let them touch the equipment. Right? All of these things do help. Before performing a physical exam on a toddler, the nurse should do what to encourage cooperation? So you walk into a kid, you got to do an assessment. Ages 1 to 3. What do you need to do first? First of all, it's minimal contact. First of all, you're going to sit there and you're going to open the line of communication. Give them a sticker. Tell them what they have cute eyes or curly hair or something. And then you can touch them by letting them touch and feel the equipment, okay? First, it's minimal contact. You can't go in and touch. They don't like that. What would you suspect if you note that an infant's chin is quivering, the fists are clenched, and they're inconsolable? What do you think that is? This is pain. This is absolutely pain. And that's the unconsolable, inconsolable. You can't console them. That's not food or anything like that. That's absolutely pain. They're banging their head. They're telling you the location. Maybe it's their ear or mouth, their hand, telling you their throat hurts. Multi. Erickson describes infants as trust versus mistrust. What does trust mean? It's all about psychosocial. It's about the people around them, right? So it's they're secure, happy because they know somebody's going to go pick them up and they're going to be happier kids, okay? The infant has to cry a long time. That is mistrust. A 3-year-old is having an outpatient procedure. How would you help the child to be less fearful? So again, let them have a doll and let them touch and feel. You've got on their level first. You broke that open. Then you bring in a doll. You show them what they're going to do and maybe show them that equipment. Now they know what's going to happen and they're going to be a happier kid. A multi. You need to do an assessment on an infant. And you walk into the room and the infant's asleep in the mother's arms. What are you going to do? You need to do an assessment. Kid's asleep. And it happens all the time. This is when you've got the prime opportunity to listen to the heart and the lungs. Because when they're moving and cooing, you can't really listen to heart sounds or breath sounds, can you? So you're definitely going to really take the opportunity to do that, okay? Listen to their heart, listen to their breath sounds. When do you switch formula breast milk to whole milk? And that is actually at 1 year. Okay, at 6 months, we introduce food and we can do whole milk, not skim milk, whole milk. They need the fat for their brain. A multi. When teaching about car seats for a newborn infant, so a gently used one, less than a year old's great. A new one, absolutely, and it's rear facing. And we're not going to have anything old because it's expired. It's not working the way that it should. Multi. When and how do you introduce solid foods to infants? 6 months, 4 to 7 days, one at a time, and you never put two together. they're allergic to fruit or vegetables, you wouldn't know. Before assessing a 4-year-old child, what techniques would you use to approach this child? And I worked in an ER and I worked a lot in the rapid area, 4 patients at a time, 4 kids. And you had to get a lot done quickly. Now, if you spent the time and you first build up that rapport, you save time in the long run because now that kid thinks you're fun. Now you are less threatening because you spend a little time and you sat down below them and you've broken open the ice, and now they think you're cool because you like Batman too, right? What technique can be used to examine a toddler? Ages 1 to 3. I mean, what do toddlers know? This is when you start using play. So tell me, do you know where your little tummy belly button is? Do you know where your nose is? And you start doing that, and now the kid has, you're doing all this assessment. The child doesn't know it, and they're not threatened by you. Now you're fun. When assessing a healthy child's lymph nodes, what would you expect? Healthy child, lymph nodes. You should not be able to feel them at all. When they're swollen, the kid is sick, okay? Lymph nodes show infection. Which Erickson stages of development levels would be used for a toddler? Automatically, me, mine. Autonomy versus, oh, you should have let me try to do that. Now I don't know what to do. I don't feel good. Autonomy versus shame and doubt is a toddler. What pain scale would you use on a 3.5-year-old child? You will see questions on pain scales. Remember, we have FLAC, we have FACES, we have numeric. Those are the 3 that I've always seen used. And at 3.5, it is FACES. Up to the age 3 is FLAC because they say that you really can't point to a picture, but it's also nonverbal children too. FACES start at age 3, up to 8, and then it's numeric. Multi. Erickson's autonomy versus shame and doubt is used to describe toddler. What does this mean? So, toddlers, you need to let them try to figure it out. And then the shame is when you don't let them. Let them try to put their shoes on. Let them try to get dressed. It doesn't have to be right. You've got to let them have that opportunity. It is me, mine, right? That's what they like. A 2-year-old is playing with mud and dirt. What type of play is this? This is sense pleasure. It's all about touch and feel, and children love that. A parent of an 18-month-old boy says that he says no to everything and has rapid mood swings. 18 months, a toddler. Is that right? Absolutely normal. Remember, me, mine, and they want what they want when they want it. Absolutely normal. What is descriptive of a preschooler's understanding of time? And its time is with events after lunch, in the morning when the sun comes up. That's what they understand. And give me an event, they understand that time. An infant shaking, crying and shaking their head. Which feature of pain is this infant showing? Again, their fists are clenched and their little chin is quivering, and you can't console them. What type is that? And that's location. A 1-month-old infant's back of their head is flat. What would you tell the mother? I mean, we're all about putting them to sleep on their backs. They're always on their back, and it's getting flat. And the mom's concerned. This kid's gonna have a flat head. And again, tummy time will help it come out and round out. Their heads are still nice and soft. It does round out. A newborn's mother has type O positive blood and the infant has B positive blood. The infant's at high risk for what? So they have different blood types. So they're sort of fighting with each other there, right? And it has to do with blood cells bursting. And this is when this child has what we call hyperbilirubinemia. This is when you put on those lights and it helps burn it out. Also, how do you treat hyperbilirubinemia? Feed them, feed them. They stool, they get rid of it that way through their stool, okay? Feed them and it will come out. Most of the time, they don't need even sunlight or even those fluorescent lights, okay? Which intervention may decrease the incidence of physiological jaundice in a healthy term infant? So this is again, let's feed them, let's feed them, let's feed them. That's the biggest, bestest way to do it, okay? Sunlight, remember, they still can get burnt with sunlight, okay? So that feeding is the safest, best way to do it. Breastfeeding is the best. Which intervention lowers the risk of sudden infant death syndrome, SIDS? There's been a lot of research done on SIDS. The hospital that was close to me, the pediatric facility, did something in what we called back to sleep. It's what we call putting them on their back when they're sleeping, okay? And that has decreased it. They used to say back and side, but they find the side that they would breathe in their own CO2 and it could cause it too. So only on their back when they're sleeping. Infants crawl before they walk. This pattern of growth and development is called, that one was on your quiz. Is what we call sequential trends. So we know that they lift their head and then they roll over, then they crawl, they creep, they walk. Absolutely what we're saying. It's that movement of gross motor is part of that. How do you communicate with parents that don't speak a language that you know? I moved from a town that there was no different culture. I come to Miami and there's a lot of Hispanic people. So initially, I didn't know. So what did I have to do in order to communicate? Well, never ever go to the older kid, the teenager that's there with mom. Always do it through an interpreter. Because if you don't, you're going to get that other person's opinion of what that parent said, okay? Always go through an interpreter. What age would most children understand under, on top of, beside, and back, around, over, all of those things? Now remember, if you have children, these things are difficult because your kids all did them at different ages. Remember what the book says. And this is at 4. It doesn't mean that some kids don't do it at 3. I understand that, but the book, it's 4, okay? In terms of language and cognitive development, a 4-year-old child would be expected to do what? So cognitive, Piaget, what should they be able to do? They should be able to follow simple commands. Put your shoes where they belong, put your dirty clothes, in the dirty laundry. They should be able to follow simple commands. What pain scale would you use to assess the pain of a toddler? Black. Toddler, ages 1 to up to 3, and nonverbal. It's FLAC. You're measuring their faces, legs, activity, crying, consolability. Faces, they have to go to the little circles and put their finger on the smile faces. A multi. What safety instructions would you teach the parents of a 6-month-old child? Well, what can a 6-month-old child do? So your car seat, absolutely. They're going to be some of them are creeping a little bit more than other and crawling. So those electrical outlets, and again, don't lay them somewhere where they can fall off and they will hit their heads. Okay, good job. A multi. What are the cognitive characteristics of a child ages 2 to 7 in the pre-operational stages? Again, it's one of those words. It's look at the ages and cognitive, and what do you think that could mean? So they don't understand what you're trying to tell me yet. They don't get that yet. Extremely imaginative. And again, they're using that broom to be the horsey or their arms to be the plane. That's absolutely normal for those children. A nurse receives a phone call from a mother that her 6-week-old baby, he's crying a lot every day. What can she do? So you're the nurse getting this phone call. 6-week-old baby. Remember, 6 weeks old, they're young. They don't really have an immune system and they're extremely fragile. They're crying a lot. What should she do? Well, you want this baby to get in and see a doctor. It could be simple colic, could be food intolerance, but it could be something extremely serious. There is no immune defense. They must be seen. Multi. What should an infant be able to do at 9 months? So we can lift our head, we can roll over front to back, back to front, we can crawl, creep, walk. Where is it? So this one, with their fingers, yeah, they should be able to hold that rattle voluntarily. They should be able to pull themselves up and they should be able to roll over. And they should sit without support. 8 months, they should sit without any support. The first expected fine motor development milestone for an infant begins with number fingers. Fine motor. What's the first thing? And that's your reflex. Remember, that's like they do it, they don't know they've done it. Then it becomes voluntary. A 2-year-old has difficulty with activity, sensory sensitivity, and only speaks one-word responses. How would you assess with what's going on here? So children at 2, they should be able to be independent and play and, should be able to be a lot more verbal. This is a child we're concerned about autism. And just know with this question that there are ways that we can check for it. And autism, as we go forward, you'll see we don't even consider it till age 2. That's when it would be diagnosed. We might see something before that, but it's not given that until they're 2. A multi. Parents are concerned her 8-month-old child's not developing like her older child. It's normal for 8 months. They should roll completely over and sit unsupported. Putting blocks in or out of containers, 11 months, okay? Blocks of 2 at 1 year. A multi. The mother of a child suspected of having mush housing syndrome. What should be in the care plan? Remember, mush housing syndrome is when you're concerned about the mother making this or continuing to keep this child sick. Remember, this is the one somebody needs to be in that room with that mother and child when the mother is there. And anything brought in there, they need to be inspecting it. Yes, the mother can come visit, but we've got to be careful. And know that you don't need somebody in there all the time with the child. The child's at danger when the mother is there. What fine motor skills is expected of a 4-year-old child? So what can they do? Fine motor's fingers. And this is a question you see, gross motor, fine motor, you've got to be careful with it. So with the fingers, it's button a shirt. Skipping is gross motor. And then walking is also gross motor. Tying shoelaces is not till about 5, 6 years old. A multi. What gross motor skills should a 4-year-old be able to do? Now it's gross motor skills. Walk up the stairs, both feet, okay? And then hop on 1 foot. Now they're not tying their shoes yet, and jumping rope is 6 years old, okay? So it's those things for a 4-year-old. RN student developmental screening on a 10-month-old should expect which fine motor skills from the infant. So 10 motors, fine is fingers. What should they do? 10 months. So it's a voluntary palmer, a reflex, a palmer, then it's a crude pincer, fine cruiser. What should they be able to do? They should be able to grasp that handle, and then they're using that pincer grasp, more of a crude up to almost a fine. Frequent developmental assessments are important for which reason? Why do we need to know if they're turning over? If they're using their hands? What we need to know that sort of stuff. Because if we're looking at this stuff, if they're not doing what they're supposed to do, we can identify delays and we can start early intervention. And as I said, the beauty of children, we can catch them up really quickly. The natural physical developmental sequence that most children follow is this is a physical development. This is your gross motor. What starts where? We start with the head, right? Head, and then we roll over, and we crawl, creep, cruise, and we walk. Yes. A multi. Which would alert the nurse to hold the digoxin on an infant she's caring for? See, this is a question why you need to know heart rates. What is normal, right? And digoxin is the same for adults as it is for children, and the things that we do monitor. Do you remember that from pharmacology? A low heart rate, a high dig level, and a low potassium level are the three things. There's nothing with bounding peripheral pulses, has nothing to do with digoxin, okay? In general, an infant should triple their birth weight at how many months of age? At 12 months old. Very good. When an infant's toe spreads when the soles of the feet are stroked, this is called, you take the foot and their toes flay out. What is that? It's the same thing as adult. It's called Babinski. Rooting is when you do their chin and they go for a breast or a bottle. Startle is also where they hands go up and they're like they got scared, like you hit the crib or a loud noise. How do you prevent otitis media in infants? So we avoid any exposure to smoke. That's the big thing. Now, breastfeeding does decrease the chances of it, but the big one here is the smoke. A multi. When entering an infant's room, the door slams shut and the infant jerk starts to cry. This is called what? Well, we know this is the one where their hands come up. It's whether you bounce the crib or you noise is there. And it's called either moral or startle. It's the same thing, a different name, okay? They both mean the same thing. A 4-year-old's reluctant to take medicine. What intervention should the nurse take? I think this is one of the biggest thing with, children, and they don't want to take their medicines, right? Some parents are like, oh my God, I give antibiotics. This is so difficult. What am I going to do here? And the thing is with these children is be straightforward. Do you want the orange medicine or the red one? Do you want it in a spoon, a syringe, or this? Do you want to chew the pill? I mean, give them a choice, let them make their choice, and then give it to them. Straightforward. That's what that means. Which intervention helps a hospitalized toddler feel a sense of control? Remember, toddlers don't like, to be stressed out. Toddlers want the same routines all the time, and they know what's coming, so they feel, less stress with that. A 3-month-old infant does not sleep through the night. What finding is most significant? Why wouldn't a 3-year-old sleep through the night? They should be about right now. Probably it's a diaper rash. Okay, that's absolutely it. An RN is assessing a 2.5-year-old toddler. Which finding should you report to the provider? Which one here is not normal? The head is bigger than the chest. Remember, by about a year and a half, the chest and the head should be equal or the chest should be bigger. It's 5:30. If you have to go, I understand. Multi-select. What are the risk factors for SIDS? Males more than females. A recent sort of thing, usually with mucus in the nose, and of course, smoke. That's a big thing. Breastfeeding decreases SIDS. What does the rooting reflex enable the infant to do? And that's when you go like this, and they'll either breast or bottle feed. Another multi. A child's been admitted with profuse diarrhea for 2 days. What would you expect? If they're getting rid of all of diarrhea, what acid-base balance is going to happen there? Remember, all of those digestive enzymes are all alkaline, right? What is left? Acid. So that's metabolic acidosis. And loss of body fluid is always hypokalemia. So that's why. The last HESI had 4 different acid-base questions. You'll see these in every Kahoots going forward. Normal language skills for a 3-year-old child. And they should do about 4-word sentences. An infant's NPO due to their medical condition. It's important to remember, if an infant can't eat for whatever reason, not even water in their mouth, what do you need to remember? And the thing is pacifier, okay? They need that for normal growth and development. And what should an infant do at 3 months? And that's lifting their head. That's the first thing. Good job, guys. I try to get that through quick enough so we're not too bad. Majestic pigeon. And faith. And number 1.
Who is Soggy Sid? And why
Soggy
are you
Sid.
like this?
I don't know. And Petra and Amber. I know you wanted to do it.
Maybe
So,
it was Sydney.
could be. Anyway, thank you so much for hanging on. It was a long one, but there was so much information in that Kahoots. I appreciate it. Remember, quiz will be next week. It'll be in the first part of the class on this week's information. Again, review the Kahoots, review the PowerPoints, and you'll be fine. And there is another discussion question. Again, any questions, let me know. And if you decide what you want for your pediatric assessment project, just let me know what you want, okay? Have a good day, guys. Thanks for your patience.